Mouth cancer, also known as oral cancer or oral cavity cancer, is a type of malignancy that develops in the tissues of the mouth. This disease falls under the broader category of head and neck cancers, encompassing various regions such as the lips, tongue, cheeks, gums, palate, and floor of the mouth. Characterized by the uncontrolled growth of abnormal cells, mouth cancer poses serious health risks and requires timely diagnosis and intervention for effective management. Risk factors. Understanding the risk factors associated with mouth cancer is essential in both prevention and early detection. Several factors contribute to the development of this condition. Tobacco use, smoking cigarettes, cigars, and pipes, as well as using smokeless tobacco products like snuff and chewing tobacco, significantly increases the risk of mouth cancer. The numerous harmful chemicals present in tobacco products can damage the cells in the oral cavity, leading to malignancy over time. Alcohol consumption. Heavy and prolonged alcohol consumption is another major risk factor. Alcohol can weaken the cell's ability to repair DNA damage, making them more susceptible to cancerous changes. Human papillomavirus, HPV, infection. Certain strains of HPV, primarily transmitted through sexual contact, are associated with an increased risk of mouth and throat cancers. HPV-related mouth cancers often occur at the back of the mouth, including the base of the tongue and tonsils. Poor oral hygiene. Chronic irritation caused by ill-fitting dentures, sharp teeth, or poor oral hygiene practices may contribute to the development of mouth cancer. The continuous irritation can lead to inflammation and eventually promote cancerous changes in the affected tissues. Sun exposure. Prolonged and excessive exposure to sunlight can increase the risk of lip cancer. The skin of the lips is sensitive, and regular use of lip balms with sun protection can help mitigate this risk. Age. The risk of oral cancer increases with age. Most cases are diagnosed in individuals over the age of 40, highlighting the importance of regular screenings as one gets older. Gender. Men are more likely to develop oral cancer than women, which could be attributed to higher rates of tobacco and alcohol use among men historically. Diet. A diet lacking in fruits and vegetables, which are rich in vitamins, antioxidants, and other beneficial compounds, may increase the risk of various cancers, including mouth cancer. Weakened immune system. Individuals with compromised immune systems, such as those with HIV, AIDS, or those undergoing organ transplantation, are at a higher risk of developing mouth cancer. Genetic factors. A family history of oral cancer or other types of cancer can contribute to an increased risk. Genetic predisposition can influence an individual's susceptibility to cancer development. Symptoms and diagnosis. Detecting mouth cancer in its early stages is crucial for successful treatment outcomes. Common symptoms and signs include persistent sores or ulcers in the mouth that do not heal, pain or discomfort in the mouth, difficulty swallowing or chewing, changes in speech or voice, a lump, thickening, or rough spot in the mouth or on the lips, unexplained bleeding, numbness or pain in the mouth or lips, changes in the way dentures fit, swelling in the jaw or neck. If any of these symptoms are present, it is important to seek medical attention promptly. A healthcare provider, often in collaboration with a dentist or oral surgeon, will perform a thorough examination of the mouth, throat, and neck. This may involve physical exams, imaging tests such as CT scans and MRI, and potentially a biopsy, where a small tissue sample is collected for analysis under a microscope. Treatment options. Treatment for mouth cancer depends on several factors, including the size, location, stage of the cancer, and the overall health of the patient. The treatment plan is usually developed by a multidisciplinary team of medical professionals, which may include surgeons, oncologists, radiation therapists, and other specialists. Treatment options include surgery. Surgical removal of the cancerous tissue is a common approach. This can involve removing a small tumor or, in more advanced cases, may require extensive procedures to remove larger portions of the oral cavity. Radiation therapy. High-energy rays are used to target and destroy cancer cells. This can be used as the primary treatment or in combination with surgery and/or chemotherapy. Chemotherapy. Drugs that target rapidly dividing cells, including cancer cells, are administered either orally or intravenously. Chemotherapy may be used alone or in conjunction with other treatments. Targeted therapy. This approach involves using drugs that specifically target certain molecules or pathways involved in cancer growth. Immunotherapy. Immunotherapy harnesses the body's immune system to target and destroy cancer cells. This is a promising avenue of treatment for certain cases of mouth cancer. Rehabilitation. Depending on the extent of surgery and treatment, rehabilitation might be necessary to regain normal speech, chewing, and swallowing abilities. This can involve working with speech therapists, nutritionists, and other specialists. Prevention. Preventing mouth cancer involves adopting healthy lifestyle practices and minimizing risk factors. Tobacco and alcohol. Quitting smoking and reducing alcohol consumption can significantly lower the risk of developing mouth cancer. Healthy diet. Consuming a balanced diet rich in fruits and vegetables provides essential nutrients and antioxidants that can help prevent cancer. Sun protection. Using lip balms or products with sun protection can protect the lips from sun damage. Oral hygiene. Practicing good oral hygiene and addressing any issues with ill-fitting dentures or sharp teeth can reduce chronic irritation and inflammation. Safe sexual practices. Practicing safe sexual behaviors can reduce the risk of HPV infection, a known risk factor for mouth and throat cancers. Regular checkups. Regular dental checkups and oral screenings can aid in the early detection of any abnormal changes in the mouth. Conclusion. Mouth cancer is a serious health condition that requires attention to both risk factors and symptoms. Early detection through regular screenings and awareness of potential signs can significantly improve treatment outcomes. Adopting a healthy lifestyle, avoiding tobacco and excessive alcohol use, and practicing good oral hygiene are essential steps toward reducing the risk of mouth cancer. If any concerning symptoms arise, seeking medical evaluation promptly is crucial for timely diagnosis and appropriate treatment.